2-minute anesthesia, cardiac action potential. An action potential is a sudden, fast, intermittent, propagating change of the resting membrane potential. The membrane potential is measured using a reference electrode in the extracellular fluid and a recording electrode placed in the cell body. This electrical potential difference is called the membrane potential. Nodal action potentials have no true resting membrane potential but generate a regular spontaneous action potential. There's 3 phases. We'll start with number 4. Spontaneous depolarization. This phase accounts for the automaticity of the SA node, whereby sympathetic stimulation results in a steeper gradient, resulting in fast depolarization and thus a faster heart rate. This is achieved by the activation of funny currents, i.e. the movement of sodium-potassium through HCN channels. It's noted as funny as both sodium and potassium enter the cell, and this is opposite to most other currents. At minus 50 millivolts, this triggers T transient calcium channels. Phase 0, depolarization. This is triggered by the opening of L long-lasting calcium channels, which triggers an action potential moving above threshold potential. Phase 3, L-type calcium channels close and potassium channels open. Non-nodal action potentials. The key difference in comparison to nodal action potentials is that non-nodal action potentials have a resting membrane potential and a prolonged depolarization phase. This action potential has 4 phases. We'll start with phase 4, resting membrane potential. This is created by the movement of potassium out of the cell, thereby the movement of positive ions out, resulting in more negative potential inside. Phase 0, rapid upstroke. Potassium channels close and you have the activation of fast sodium channels, resulting in sodium entry. Phase 1, initial repolarization. Fast sodium channels close and potassium channels open, leading to phase 2, plateau phase. The potassium channels remain open and you have the opening of L long-lasting calcium channels in order to maintain depolarization. So therefore, during this phase, calcium enters, potassium exits. The entry of calcium triggers calcium release from the SR for myocyte contraction. Phase 3, repolarization. L-type calcium channels close and potassiums remain open, therefore reducing the membrane potential. The total refractory period is comprised of 3 components: the absolute refractory period, the relative refractory period, and the supernormal period. The absolute refractory period is a period during which an electrical stimulus will not elicit an action potential because the membrane is not sufficiently repolarized and the sodium channels have not completely recovered. The relative refractory period, which requires a larger stimulus, and finally the supernormal period, during which the threshold is lower than the typical required to generate an action potential. Please like and subscribe.